In the wake of John McCain's tragic death, a lot of people may be thinking about glioblastoma, brain cancer, what ultimately killed him. We are talking Health in Focus with Dr. Jaganathan, board-certified neurosurgeon. So tell us a little bit about what glioblastoma is.
So there are two types of brain tumors, benign and malignant. Malignant obviously meaning cancerous that can spread to other parts of the brain. And glioblastoma is unfortunately the most common type of malignant brain tumor and also the most severe type of tumor. In spite of all the advances we have in medical technology over the past 60 years or so, the survival for glioblastoma, the average survival, has only gone up probably about 4 weeks. So it's still largely unknown in terms of how we treat it.
Wow. And obviously it's in the brain, so that adds probably more complications for a patient.
Yeah, so glioblastoma is unlike metastatic tumors that are tumors that spread from elsewhere in the body, start in the brain, and because of that, the brain is protected from the rest of the body by what's called a blood-brain barrier, and so it makes it harder for medications, chemotherapy, and stuff like that to enter the brain. And even if they do, oftentimes these medications can have toxicity, which patients can be very sensitive to.
How common is this?
Glioblastoma is among the most common types of malignant brain tumors. Fortunately, the most common type of tumors in general are benign tumors, such as pituitary tumors and meningiomas. But in terms of malignant brain tumors, it's the most common brain tumor that's there.
Okay, and not to scare anyone, but what are some common symptoms or things people should look out for, maybe be a red flag?
So because this glioblastoma start in the brain, typically you don't have symptoms like weight loss that you typically see with tumors that start elsewhere in the body. A lot of times patients have headaches, they have nausea and vomiting, seizures can be problems, visual problems. So a lot of times the symptoms are subtle, and because of the location of the brain, a lot of times it's not looked into properly until the tumor has grown extremely big.
Probably that's one of the key factors of why it's so untreatable. Right?
Yeah, I mean, one of the major factors in terms of providing a good survival with these tumors is the ability to resect it or remove it safely. And when the tumor grows really big, it becomes very hard to do that without causing damage to the rest of the brain.
All right. Well, thank you so much, Dr. J. We appreciate it. And if you want some more information, you can find that on our website. You can head to 9in10news.com.
This Health in Focus is a paid segment by Jaganathan Neurosurgery.